Hello and welcome to Embracing Senior Health, sponsored by Embrace Hospice. I'm your host, Candace Howell, and today we're going to focus on the differences between assisted living facilities and nursing homes. And I'm joined by some great guests today. I have Mike Beard, the Executive Director of Myrtle Beach Manor, and Patty Fink is with us again. She's a social worker from Embrace Hospice, and I also have Charlene Hope from Embrace. So thank you all for joining us. Appreciate it. You know, we have these great discussions on this show about not just end of life, but as we're nearing end of life and what our options are. We need to be thinking about those really at all times in our life. So we want to discuss today assisted living versus nursing home and the differences, Mike.
Mm-hmm. Yeah, it's really, we're seeing more and more people as they're aging looking at what's the difference between the two. Assisted living, we can do a lot of care in assisted living, but at some point when someone requires too much care, we've got to look for them to move over to skilled nursing. And at Myrtle Beach Manor, we have both. So that's definitely a plus.
So if I'm walking into the facility, kind of paint me a picture of the facility. And I've been there. And the one thing I have to say is, if you're going to visit someone there, make sure you eat, because it is delicious. It is so good. And we'll get to that with the services. But paint me a picture.
Well, we've just finished a $3.5 million renovation. So in assisted living, we built a new dining room. It's two levels. It has a large activity area. We have activity areas on both floors. It's 2 floors in assisted living. And it connects to our skilled nursing and our new wing, which we call Rehab to Home, which is exclusively for the residents that are coming from the hospital, hip replacement, knee replacement, heart, short-term stay, 7 to 21 days, in and out. And we've set the rooms up like hotels, 32-inch flat screen, Wi-Fi. They have their own menu, their own gym. They're a complete entity to themselves, so they're really not part of the skilled nursing home or assisted living.
And so on the nursing home side, kind of tell me a little bit about the differences there.
Great thing we did there is we have their dining room, we have an activity center, we have semi-private and private rooms. Your goal is always to keep someone in assisted living as long as possible. And as they approach end of life, sometimes, well, the state of South Carolina really requires us to move them to skilled nursing. And at that time, we're also looking to hospice to bring them in for the extra services. Maybe it's pastoral care, just a little extra care that they'll receive.
Well, Charlene, talk a little bit about that relationship between you guys and the facilities like Mike's.
It's really important, and we've had patients in assisted living too. If they have an end-of-life medical condition and they're able to get up, get to the dining room, feed themselves, and just need a little bit of help with bathing and dressing and maybe medication management, because the assisted living doesn't have the ability as the skilled nursing facility with the nursing staff there 24 hours a day. So the hospice nurse is kind of the person, that the case manager, that kind of brings that all together. Once they get into the nursing home, and a lot of people say, you know, why do you need hospice if they're in a nursing home? Nursing homes have nurses. Well, we know in a nursing home, Mike, you have a lot to deal with. Yes. And we as a hospice team can come in and supplement that. We can work with the nurses, give them that support, spiritual care, social services, because social services, your social workers are busy, 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 and if we can spend, you don't have a lot of time that you can spend, the hospice team, and volunteers. The volunteers can go into the building as well to sit with somebody. It may just be to hold their hand, and certainly the family support, very important.
So, Mike, who should be considering assisted living?
I really, when I meet with families, we generally meet with the daughter-in-laws.
Why is that?
90% of the time, the decision is made by the 45 to 65-year-old female.
We're the tough ones, see? That's what that's about.
I always say we men are wusses, and we're not going to put mom or dad away.
No offense, gentlemen. I didn't say that. Mike did.
It really, you know, the nurturing that a woman has, she's going to look out for what's best for mom or dad. And it gets to a point where maybe they can't drive anymore, aren't cooking their own meals. You find that they're eating peanut butter and jelly 7 days a week, 3 meals a day. They're not getting the nutrition that they should get. They're not socializing. And assisted living offers all of those things. They're going to drive them to Alabama, to Carolina Opry, to Walmart, to Target.
Kind of keep them active and engaged with society.
Exactly. Wii Bowling. We've got 4 different Wii Bowling leagues. We're right on the Intercoastal Waterway.
Leagues?
Oh,
that is great.
it's cutthroat.
I love it.
Yeah.
I love a little Wii bowling. I think I might have to check out the leagues.
It really is a lot of fun. And you get your 3 squares, snacks throughout the day, entertainment coming in and out. We're very blessed to be here at Myrtle Beach, where we get a lot of these acts that'll say, hey, you know, I've got time. I'm going to come in and spend some time.
Well, perfect. Well, this is a great conversation that we're having, folks, if you're just tuning in, about assisted living versus nursing homes, and we're tying in a little hospice care there as well. So we're going to have more after the break, so stay with us. We'll be talking about costs and the services provided a little bit more in depth with assisted living, and we're specifically taking a look at Myrtle Beach Manor today. So stay with us. We'll be right back.
If your doctor refers you to a hospice program, you may continue to keep him or her as the primary care physician. Many hospices ask you to take their medical director, but you do not need to do this. Your doctor can be your doctor through your hospice journey. Many people think that because you've been referred to a hospice services, that you cannot remain in your home and need to go to a facility. That is not true. Your end-of-life care can be provided by your hospice team in your home where you're most comfortable.
Hello and welcome back. You're watching Embracing Senior Health, sponsored by Embrace Hospice. I'm your host, Candace Howell. This is a great show that we have every Friday here at WMBF at noon. I have some wonderful guests with us here today, and we're talking about assisted living versus nursing homes, and really when we need to be looking at placement there, but also Mike, talk to us a little bit about the costs of assisted living in nursing homes.
In our community, we have 4 different style rooms. So we have a companion suite where you have your own bedroom, and in between your bedroom and your roommate's bedroom is a bathroom and a shared kitchenette. That's $22.50 a month. And that's all your meals, your laundry service, your housekeeping. Then a small private suite is $2,500. You go up to a larger suite, and it continues to grow till you get a full 1-bedroom apartment at $34.50 a month. And then we have care level fees. So, for example, if we're doing someone's medications, there's a fee. If someone's a brittle diabetic, the fee increases. If we're doing bathing, personal hygiene, again, it increases. We can do a lot. We have some folks that are wheelchair bound, and we can care for them in assisted living. So that really works out real well. And as someone declines in our assisted living, if hospice comes on board, we may be able to lower those care costs because hospice can provide some of those services.
And Charlene, talk a little bit about that, and Patty.
Well, I think the main thing is that we provide on a daily basis a home health aide to come in and actually do the care. Yeah. Do the shower, do the bath. We provide the supplies, the medical supplies, you know, incontinence supplies, dressing supplies, anything like that. And we pay for some of the medicine, which that's a really big help for families if it's related to their hospice diagnosis.
Mm-hmm. And Patty, how does this work out for the families in terms of, you know, every little bit counts as a savings?
Every little bit does count. And when you add the supplies, the medications, and the home health aid, then you can go back some of the basic price of what Mike's offering them, and then we can provide those services. So that way it can extend their time in assisted living and not having to go to a skilled nursing facility, which is a little bit more expensive. But also what it does, it gives the family a peace of mind, because if they live out of state and they can't come every day, they know somebody's in there every day just for their loved one to keep their eyes on them. And then we can also be the eyes and ears for the doctor as well. So we can help the facility with medications changes and just coordinate that care with their staff. And work with their staff to make sure that that patient's getting what they need, that the quality of life for them is where it needs to be, is at the maximum it can be.
Well, let's talk a little bit about that, Mike, quality of life. And I know you guys take great pride in what you've been able to set up at your facility. Give me a day in a life of someone who's in assisted living or the nursing home.
Typical assisted living, we serve breakfast from 7:15 to 9 in the morning. So we really have the flexibility. The residents can get up when they want, come down. And I always like to say that it's as good as Cracker Barrel. Yeah, they can pretty much order what they want. Then there's exercise class at 9 in the morning. There's another activity in the morning. Lunch is 11:45. They have their choice of entrees at lunchtime. Then there's 2 or 3 activities in the afternoon, a social, a happy hour. As long as there's no restrictions, we serve beer and wine during our socials. And then their evening dinner, and then usually an activity afterwards. And skilled nursing is not that much different from the standpoint of we still do the breakfast. It's normally 8 o'clock in the morning. We have to follow their diets, so they may not be as able to pick and choose as they'd like. There's activities, 2 or 3 activities in the morning. Lunchtime, they again have choices. My philosophy, and I believe our community's philosophy, is somebody's a diabetic and they want a piece of banana cream pie, give them a half a piece. If they're 94 years old,
let them have their banana cream pie.
Exactly.
Give them the whole piece.
And naturally, there is nurses 24/7. You've got more, the aides have received more training. You've got, everything's all-inclusive in skilled nursing. There is no care level fees. It's a flat rate. And we're very fortunate here in South Carolina. The national average, I believe, right now is about $8,000 for a private room per month.
Wow.
And probably here on the beach, you're looking at about $6,600. So it's relatively cheaper than the rest of the nation.
Well, that's really good. So what about, what does Medicare do? Where does that come in? I know a lot of folks are still getting therapy and they worry, can I get care if I'm still in therapy?
Great question. We have a lot of folks that will come from the hospital. As long as they've had a 3-day qualifying stay, 3 nights they stayed in the hospital, they can come to our rehab to do therapy, whether it's knee replacement, hip replacement, heart attack, COPD, whatever their ailment is. And we will develop a comprehensive therapy plan. We will try to do 2 to 4 hours of therapy 7 days a week. We now offer therapy 7 days a week. Wow. Our goal is to get them back home. But there are the occasions where the reason they did go to the hospital is because they have deconditioned and they're not ready to go home after they've hit their limit in their Medicare days. And Medicare pays full amount for the first 20 days, and then there's a copay from day 21 through day 100, but you must be meeting Medicare criteria. Right. There's no guarantee of 100 days. Okay. And there's a copay is $152, so it's, a lot of people have supplemental that offsets that. But a lot of times what we'll refer someone to is assisted living to do a respite stay. Stay an extra month in assisted living, get 3 days of therapy under your Medicare Part B benefits to get stronger. And then the decision can be made, can you go home, or maybe it's appropriate for you to stay in assisted living.
Well, this is great information. We're going to continue the discussion right after the short break. We're going to be talking more about assisted living, more about insurance and services that are offered in assisted living and nursing home care. Stay with us.
Hospice pays for the majority of medications that patients are on upon admission to hospice. We take care of medications from prescription from your doctor to the delivery of medications to your home. We take care of all of your needs with your prescription medications.
We at Embrace Hospice are not only dedicated to our patients and families, but to our veterans. A retired Army veteran with 27 years and my chief nursing officer with 20 years, a retired Army nurse. We believe that veterans deserve the care for what they did for our country at the end of their life.
Welcome back to Embracing Senior Health at WMBF News. We've been talking about assisted living and nursing homes and the options and really who should be starting to look at these facilities. So Mike, tell us a little bit about some of your patients. Like give us kind of a look into the life of the patients.
Quite often, a lot of our patients will start at the hospital. Somebody has had problems at home. They've gone to the hospital. They'll do their 3-day qualifying stay. They'll come to our rehab. And everyone's goal is always to go home. But sometimes you have to really have some frank, realistic discussions with families and say that's not an option. I'll give you an example of Mr. B. The family wanted him to go home. Well, he just is not capable of being home alone. So we go through the options. We say, okay, the doctor's not going to recommend that they be able to go home alone. We really feel that initially we're going to need to do as many therapy days as we can and then reevaluate. Can he go to assisted living? Or maybe with this diagnosis of dementia, he needs to go to our Bridge to Rediscovery, our memory care unit. And quite honestly, sometimes we have to have that really tough discussion with the family and say, you know what, they need to stay in skilled nursing, and we need to reach out to the hospice folks and look at them to come on board.
And Patty, and you're dealing with these patients and having those very difficult discussions. How can Embrace help, Mike, with those discussions with the clients?
We do coordinate care, and we do have case conferences with the family and the social worker and the team. His team and our team can collaborate together, and we can offset some of the fear that the family has, both financially, both with, well, what kind of care is my dad going to get, mom's going to get, how can we do this and work together? Then we can come in and offer that special one-on-one care that would help send them over the edge of making the decision to stay, and what the safety issues, could be relieved at his facility versus going home.
And Charlene, how do you feel about having multiple people in that conversation? How does that help that conversation go?
It helps a lot. It helps a lot. The more the better. And we always find that we deal with one child, and then the next one comes, and the next one comes, and they all have their own ideas. So if we're all together on the same kind of saying the same thing, us as hospice and as the skilled nursing assisted living, then we're a team. And they're hearing, hopefully, after many, many meetings, they're hearing the same thing. It's very hard. And if we put ourselves in their places, I think we can be better understanding of what it is. If you've had an elderly parent, you certainly know what that is about.
Yeah. And Mike, it's safe to say when you guys collaborate, money can be saved as well, right?
Yes. As they stated before, their medications. Hospice will cover the medications related to their diagnosis. They'll cover their incontinence products. All of those things they would be paying out of pocket for. They don't cover their stay, but they do cover the incidentals, and that can be a substantial number. And we're talking about conferencing. 70% of our residents are from out of state previously, so getting a hold of their children, it's usually a conference call, our therapy director, our social worker, your workers, so that they are getting a good rounded picture of where that resident's at and what our expectations are.
Well, and you guys have some of the best services possible, a great facility, and I think it's really important that you do all network and work together. It's going to provide the best possible care for the patient. So if you have a loved one that's in this situation, I urge you to contact Embrace Hospice or reach out to a facility like Mike's with Myrtle Beach Manor. So we've got much more coming up after the break. Stay with us. You are watching Embracing Senior Health. We'll be right back.
At Embrace Hospice, volunteers are the backbone of our care. If you feel that you could provide quality, compassionate care to one of our hospice patients, please call 1-855-OPEN-ARMS.
I'm encouraged that here at Embrace we have several competent, compassionate, spiritual care coordinators that come alongside the patients at the end of their life and help them in their spiritual journey.
Welcome back to Embracing Senior Health. We've been talking about assisted living and nursing home facilities. Have some great guests here with us today. Thank you so much for joining us again. So one more time for the folks at home, Mike, tell us the difference between assisted living and nursing home. And I want to point out that your facility, these are the same campus, if you will.
Correct. Basically, assisted living, they still have to be able to do some things for themselves. And your average rate is probably roughly around $3,600 a month. Skilled nursing, we're pretty much doing everything for someone. Average rate there is around $6,300 a month. So significant cost difference, but it's also a significant increase in the amount of care that a resident receives. Still got same meals, still got a lot of the same activities. It's just a matter of how much care a resident requires.
Definitely. And you guys work so closely with Embrace and some of these other great organizations in the area. And Charlene, the importance of folks at home being able to get a hold of you guys at Embrace Hospice. Let them know how they can reach you and the services you provide.
They can call us right here in Horry County, 843-347-1884. We're open 24 hours a day. We'll answer the phone and we'll get right back to you, and we welcome your calls.
And Mike, how can they reach you guys at Myrtle Beach Manor?
843-449-5283. We also have myrtlebeachmanor.com. We have people that'll do tours 7 days a week. Love to have people stop in and have a meal. As you said, the food's delicious.
It really is. The spaghetti is fantastic, so that's the one you definitely need to try. Well, thank you all so much again for joining us. It was a great conversation about assisted living and nursing homes. And we will have more next Friday. We have Embracing Senior Health every Friday right here on WMBF News. This show is brought to you by Embrace Hospice. Thanks for joining us today. We appreciate it. These are the tough conversations that we need to have, providing you with the best information only on WMBF News.